Moorama footprint covers 200,000 square kilometres, the main communities being Broken Hill, Wilcannia, Menindee, Dareton, and the majority of the footprint encompasses the Barkindji cultural boundaries.
In about 2005, Moorama established a program to do adult health checks in all of our communities. And when we had a conversation about what we would screen for in the adult health checks, we were a bit stuck on smoking, because obviously we wanted to ask people if they smoke. We knew the prevalence was high, and we know smoking is a risk factor for disease.
The Moorama Smokers Program really suits the Aboriginal community, because the Aboriginal community are one of the hard to treat population groups around tobacco.
The community know that smoking kills people, and so they actually have an expectation of us as health workers when they come to a health centre, one, to not see us smoking, and two, for us to ask them about it and provide support for them to quit.
Hi, Elaine.
Hello, how you going there, mate?
How you been?
Oh, all right.
Yeah?
Yeah, what have you been up to?
So, you know why I got you back in, don't you?
Yeah, because the insulin wasn't working for me.
Okay.
And they said, I seen the specialist. Well, I'm 58 and I'm a diabetic. So, and the doctor was always harping on me to give up smoking because of my diabetes and everything.
Elaine, I notice you're still smoking. How do you feel about smoking now?
I still smoke coal, but I know I've got to give it up because of the diabetes and everything.
Have you heard about a program at Moorama?
Oh, the doctor. It was my friends. They all smoked. Everyone smoked. Work. Everyone smoked. They all went outside thing, and I used to think, oh, I'll go out and join them and have a smoke.
So what I'll do is I'll refer you on to one of our caseworkers, and they'll follow you up and bring.
First thing in the morning, as soon as I got out of bed, I would have a cigarette in my hand, and I would smoke, and then I'll have breakfast, and then I'll have a couple of smokes.
It's hard to give up, but once you give up, you'll find it a lot easier. We're here to help you, we got.
If they've come in and they've said they want to quit, I ask them why, and that we do have a 12-week program that we have at Moorama, and we can start them on a management plan.
We have a cohort of workers trained in the Smokers Program from different disciplines, but also from different backgrounds. So we provide the nicotine replacement therapy to support community members to deal with their physical craving of tobacco, but also we have the intense weekly follow-up.
We believe we have their trust, so we need to reconfirm with them that if they do start smoking again, that we're not there to judge them, and that we'll try and get them back on track and support them onto the program again.
Alright, so Uncle Collie told me that you wanted to give up smoking.
Well, I want to try.
I want to try.
I want to try, Chris. I think it's time I've tried.
Alright, so what are some withdrawal symptoms you had last time you tried quitting?
Or just mood swings.
Mood swings?
You know, your uncle, your aunts, your mum sometimes smokes, your father smokes, so, you know, I've noticed in the younger generation they don't seem to be taking it up as much, but yeah, definitely the older ones sort of still they're hard smokers and core smokers. So.
Just get that. This is just to show you that it goes down when you quit, so you can actually see how healthy you start to get.
When I quit smoking, with my family away, that was good, but I had the support of the workers at Murra Health. They were really good. I could pop in and see them, or I'd ring them up. There was no hassles, and they just kept encouraging you all the time, and it was just the positive feedback I got from them that you thought, well, I don't want to go back to smoking anymore.
The Moorama Smokers Program is successful because the combination of that supportive counselling approach and also using the nicotine replacement therapy, which we subsidise for the community, so it's affordable.
The evaluation found that after 12 months, 26% of people who'd joined the program who'd attempted to quit had quit. So we thought that was a pretty decent effort, and it's pretty consistent with the evidence overall.
The temptation is still there to take it up, especially when my friends are still smoking. And then I look at them and think, oh God, no, I don't want that. Okay, thank you. Having people tell me how good I look in the face and my hair and I don't smell and I look great, it's the best thing.